Thank you everyone for your patience. We had some technical difficulties. We're going to be beginning shortly. Thank you everyone for your patience. We had some technical difficulties. We're going to be beginning shortly. If you're on and you're not a speaker, please mute yourself. If you wish to change your name, you can do that by clicking the 3 buttons in the top right corner. That will allow you to remain anonymous if you wish to have your name not on the Zoom screen. Again, I apologize. We're just having some technical difficulties. Please, everybody, mute yourselves. Hi again, everyone. If you're just joining, thank you so much. We were having some technical difficulties. We had to switch to a Zoom meeting. If you'd like to be anonymous, you can change your name by clicking on the 3 dots in the corner of your screen. And you can change your name to however you want it to be displayed. We ask that everyone keep their microphones muted unless you are a speaker.
Well, in 65, they passed, but they want to get into the AP, so they take it.
Hi, everyone. Thank you again for joining. We were just having some technical difficulties and had to switch to a meeting instead of a webinar. Thank you so much for your patience. If you'd like to make it easier for your viewing purposes, select View in the top right corner of your screen and switch it to Speaker View, and that will allow you to be focused on whoever's talking. Thank you so much for your patience again.
For part two of our substance use series, we'll just wait a couple of minutes, very short time for some more people to join. And thank you for sticking with us through our technical issues. On the screen now is a QR code. If you scan this code, it will lead you to a pre-survey. Entering the survey will make you eligible to win a $100 Amazon gift card. There will also be a post survey at the end of this webinar, and completing that will also put you in the pool for a $100 Amazon gift card. Filling out the survey will give us useful information that we can use to inform future discussions. Okay, so in just a minute, we'll get started. Thank you again, parents and teens, for being here tonight. In the chat, there's also a link that you can click on that will lead you to the pre-survey as well, if that's better for you. So I encourage you to quickly fill that out if you can, and we're going to get started. So thank you for joining us tonight for part two of our JOWMA Substance Use series, focused on awareness, prevention, and response. Tonight, we hope to have a frank discussion with parents and teens on substance use in our community. So welcome to all the teenagers and parents who are here tonight to learn, to ask questions, and to come together. Some of the big topics we hope to cover tonight include the effects of substance use on teenagers, how to identify when there's a substance use issue, and how to navigate these challenges within the context of the family environment. We have a bunch of questions that have already been submitted. And also, we welcome you to submit your own questions into the chat box, and we'll try our best to cover them. Some of the questions are written from the parent's point of view, and some of the questions are written from the teen perspective, but we think the answers will benefit everyone. So before we get to the questions, I'm going to introduce our two panelists for tonight. Okay. So tonight, we're here with Rabbi Tzvi Gluck. Rabbi Tzvi Gluck is the CEO of Amudim and spends his days and nights heading Amudim's operations, channeling his energies and inborn skills to ensure its seamless function. A Queens Hatzalah member who also serves as a Port Authority of New York and New Jersey Police Department chaplain and an NYPD clergy liaison, Rabbi Gluck was ordained as a rabbi in 1999 by Rabbi Moshe Faskowitz of Yeshiva Madregas Ha'adam. He enjoys reading and world travel, particularly to locations of Jewish historical significance. Rabbi Gluck lives with his wife and children in Kew Garden Hills. Also here tonight, we have Esti Esses. She is a licensed clinical social worker who specializes in treating clients struggling with addiction and families affected by their loved ones' addictions. Esti runs groups for partners of addicts and also runs a relationship restoration program for couples and families recovering from the aftermath of addiction. Esti also runs a trauma group for men and women as part of an intensive outpatient program based in Brooklyn. Esti is EMDR certified and is trained in internal family systems. She is passionate about helping people to heal from past traumas and to live their best life. Thank you so much, Esti and Rabbi Gluck, for being here with us tonight.
I'm so honored to be here with everyone.
So, Rabbi Gluck will join us shortly. So our first question I'm going to address to Esti. So the first question tonight is, just how common is substance use among Orthodox Jewish teens?
Okay, I'm going to say that unfortunately it's extremely common. Every single Jewish high school is dealing with this issue. So it's really, really common. Oh, and I see Rabbi Gluck, so that's good.
Hi, Rabbi Gluck.
Hi.
Hi, thank you so much for joining us. I just opened up with the first question of the night, which was how common is substance use among Orthodox Jewish teens? And Esti said, it's more common than we would like.
I don't know. It depends which school principal you ask. They'll tell you it doesn't exist at all. But are you asking me to answer the question, or are you just bringing me up to speed?
Bringing you up to speed and inviting you to add in anything else you might want.
Okay, so I think what Esti said is definitely correct. And I'll say the same thing that we've said in the past and previous. You'll hear a lot of commonalities in the responses, but they're coming from different angles, whether it's the clinical side, the communal side, but there is going to be a lot of duplication that's just to be understood. I will say this very straight up. I don't know a single high school, from the most uber yeshivish to the most modern Orthodox to secular to non-Jewish to anything in between, that can safely tell me that there's no drugs in their high school. And any school that tells me there are no drugs there, either there's no school or there's no students. It's one of the two. So that's my answer.
Thank you so much. So Esti, the next question is, why do teens use or misuse drugs? And why do some teens develop an addiction and others don't?
Okay, yeah, that's a really, really great question. So I think it's important before answering that to really understand a little bit about the teenage stage in general. Teenagers between the ages of probably 11 through 18, it's a very highly emotional, volatile time period in terms of life development. A teenager is that their brain is hyper excitable compared to later in life. So during these years, a teenager is being introduced to emotions and they're learning how to relate to themselves, how to relate to others. They're developing a sense of self. They're really supposed to be wrestling with huge emotional upheavals. That's just the stage that they're in. There's usually a natural anxiety during this time as their body is developing and changing. There's usually social pressures, academic stress, maybe questions about religion, sexuality. And so I think that that is why when you throw in a substance to the mix, you'll see teenagers jumping on that because it really will speak to the emotional issues that they're faced with. It will really, it's like an answer to the teenage stage, to the thing that the teenagers really have to do, work through their feelings. The drug or the alcohol will just be an easy answer. So I think that's why you see misuse happening a lot during the teenage stage.
Thank you. Yeah, it seems like teenagers are more likely to think about the social benefits, if you will, of using the substance versus evaluating the negative possible consequences.
Yeah.
And Rabbi Gluck, one of the
I
questions.
can answer that just before you say. First of all, I want to just go on a different angle from the communal side. Number one is it could be fun. Teenagers hear from their friends, and it may just be something as innocently starting as I want to experiment with something. And I'm going to reiterate what I've said many times, which is if we don't educate our children at younger ages, we can't expect them to know the difference. And I'm going to just repeat a study that was done in conjunction with the Office of the Chief Medical Examiner in New York City, of which of the people from within the Orthodox community that were adolescents that died of a drug overdose, the bulk of them very often were first-time users, which means they did not understand the ramifications of it. We also need to keep in mind that there's genetic predispositions to addiction. So there's a very big difference between somebody trying, which I'm not advocating for that. Let me make that very clear. But you say, why do some teenagers get addicted and some don't? So that could fall into one of three categories. Either there's a genetic predisposition, and then there's also one, we're going to go based on marijuana with this, because it is becoming legal, and just because something is legal doesn't mean it's good. But there are people that use drugs to run from, and people use it to run to. And that really creates the difference as far as what can be predisposed for someone to create the addiction component. If somebody is running from something and they're using drugs to get away from whatever that dark hole is, there's never an end, because whatever they're using, that hole is still there. It's never going to be filled. So that's why looking into underlying reasons and the other issues surrounding are extremely, extremely important. And in the world we're living in today, where it's an empty world, social media became this fake reality of how many likes do I have and how many, retweets. I shouldn't even say that. I'm aging myself. I'm sorry. How many TikTok views or whatever, every 2 days there's something new. So everyone needs to do something to step up, and we're feeling very empty. So therefore, the teenagers are very often looking for something new. And the last thing that we've seen is very often we're living in a society now that thankfully, in many ways, people being on medication is much more accepted. However, there's unfortunately that situation where there might be someone in high school prescribed medication for ADHD, and one of their friends might say, hey, I have a test or I have something else. Can I get a pill from you? And this is something that we are seeing more and more of regularly. So these are the types of things that have to be careful with when it comes to those.
Thank you so much. So that response actually addressed or hit on several things that came up when questions were initially submitted. So we will touch and get into more detail on some of those things. Rabbi Gluck, speaking about, the communal level, who should start the conversation? Should it be the parents or should it be the kids when it comes to bringing this up? That was one of the questions we received.
I mean, I think the answer is both. I mean, who starts the conversation when a kid can cross the street? To look both ways, right? Is it the kid saying, Mom, Dad, I'd like to be able to cross the street by myself to visit my friend? Is it the parents saying you're old enough to do it? I think it's a very mutual conversation. I think the fact is we've created this false narrative of if we discuss a topic, it's going to become real. And what ends up happening is let's not discuss something. And the studies clearly show, specifically in alcoholism, right? So they say that the average parent will first have a discussion with their child between 13 and 15 years old. The average child will have their first, we'll call it illegal drink, meaning that their parents don't see or anything between the ages of 11 and 13. So there's kind of a gap where if we're not communicating, it's very hard to know. But it's really not just the parent and the child. And this is something that I really have to mention and drill it in as much as I can. But there's three partners. There's the school, the parents, and the child. And as long as our schools are still in a place where they're not willing to acknowledge and address alcoholism, addiction, vaping, mental health issues, eating disorders, suicidality, suicidal ideations, etc., guess what? The parents and the child can speak till they're blue in the face if they do, but it won't go anywhere because as soon as the child actually feels something and might want to say something in a school setting, they're worried they're going to get into trouble or something else will happen. So it's really the parents and the children both, but it really has to be all three. The schools must be an active part of this conversation as well.
Thank you. Yes, and we're hoping that by having these events and getting everyone to participate and submit their questions, that we'll all learn together and start to kind of break down the stigma a little bit. And on that note, the chat box is now enabled. So if anybody wants to enter a question, please submit your questions in there. And for anyone who joined just now, I'm Dr. Eichenbaum. I'm a fellow in child and adolescent psychiatry at Montefiore, and I'm here with Rabbi Tzvi Gluck of Amudim and Esty Esses, who's a social worker who specializes in addiction. So Esty, we touched on this a little bit, but maybe we can kind of address this one directly again. So one of our members asked, trying a drug is different than being addicted. So why won't my parents let me experiment? And when does it stop counting as experimentation and become a problem?
Okay. So I'll go to the second part first. What's the difference between experimentation and addiction? And just point out the signs that how someone can know, oh, okay, this is an addiction. So one is when the person is seeking it out or obsessing about it. It's not like they're just like, oh, everyone's doing it, I'll join in. But it's like they're actively seeking out and they're obsessing about it. The second sign is when an adolescent or a person can't stop using, even though they want to. They make a decision, I'm not going to use again, and then they find themselves using. And even though there are negative consequences, they continue to use. And then the third difference is withdrawal symptoms. They start to notice withdrawal symptoms. They feel cranky, irritable, and empty when they're not using. I think that the reason why parents don't want teenagers to experiment speaks to what I was speaking about before, that a teenager and adolescent's brain isn't fully developed, and it will be very easy for a teenage brain to become addicted or to just use drugs or alcohol as a numbing device instead of being able to really develop the way that a teenager is supposed to. And just to jump in on the last question that was asked, I really think that it is a parent's responsibility to educate their children and their teenagers about what getting through teenagehood successfully looks like, and about why they don't want their adolescents or their children to use drugs or alcohol. I think it's on parents to really do the education. And like Rabbi Gluck mentioned, educating our teenagers is the best way to really help them. It's through education. So I think it's on the parents to do that.
Thank you. And let me just jump in, just to add to what you said, just to bring up a few other points. Imagine somebody says, hey, my grandmother has high blood pressure. I just want to experiment with her blood pressure medication. Would any parent in their right mind ever say, oh, sure, that's a great idea. Why don't you take her heart medicine, her blood pressure medication, etc.? At the end of the day, that's not just because somebody wants to experiment doesn't mean we have to give the right to. You know, it's very different when you see a sign that says wet paint, let me touch it, versus, hey, I'm going to try something. And just to add one piece to the brain developing part, in addition to the fact that there's an issue with the brain development, let's also not forget that until the human brain is fully developed, which is at the earliest 23, many experts will say closer to 26, a lot of these substances, drugs, alcohol, marijuana, probably one of the highest of these, actually affects the brain development. So people will say, hey, what about alcohol? Well, let's not forget the amount of younger people we have now with liver issues is also a direct result of alcohol. So it's very important for people to understand that the danger is not only the word addiction. Everyone's scared of the word addiction. Oh, and I've heard this so many times. I don't have an addictive personality. I'm not going to get addicted. Okay, but you'll mess up your liver. You'll mess up your brain function. So it's really about really educating. And I always say this, speak to the kids, not like they're adults, but with the explanations that you would give an adult. So you can go to drugabuse.gov, I'm sorry, which has amazing talking points of how to speak to children, adolescents, even people that are older, but speak to them from the chemical component, from the neurological component, from the factual data-driven components, as opposed to saying, I don't want this happening to you like what you saw happen to so-and-so. Actually give the explanations. Kids do appreciate that, at least from what we're seeing, more than just saying, don't do it because.
Totally. Just emphasizing that the teenage brain is not the same as an adult brain, and it's definitely more vulnerable, as is the whole body. Like you mentioned, there's other physiological effects of various drugs on other organs outside of the brain, like your liver, like you said, even growth and development when some of these substances are used and interfere with other nutrients the body needs. So definitely could affect, psychological development, emotional development, the neurochemistry of the brain, and the person's physiology, which is different in a child or a teenager versus an adult. So on that note, we can go back to Esty. What do I say if my kid asks me why I can drink alcohol, but not him or her? Or if my kid asks me if I've ever tried marijuana and the answer is yes, how do I have that kind of discussion with my kids?
Yeah, I think it's really important to be open and honest with your kids. And if someone's tried marijuana or has a personal experience, I think that's great to be able to share that with your child. And I feel like I'm repeating myself, but to explain to your child the difference between your brain and their brain. Something I think that speaks to why a teenager can get addicted so much faster than an adult is because addiction actually uses the same system as normal learning does. So like when you learn a task, you're memorizing, and the brain is actually strengthening as it memorizes. And children and teenagers, they do this learning process very robustly, better than adults do. They just learn, their brain is learning things really quickly. So unfortunately with addiction, when as a teenager starts to use that, it uses that same, the same system of the learning. And so as a teenager, brain is learning about addiction, it will become addicted. He will become addicted much faster. And you see that teenagers who became like adults who got their addictions when they were in the teenage years, they struggle sometimes for a lifetime trying to shed that addiction because they acquired it at such a young age. And it's like we have to rewire their brains because their brains are wired, it's wired into their brains. So it's such a vulnerable time, teenagehood.
Add to that also, as parents, I mean, I have teenage kids, lead by example. And that's really the most important thing. From a communal standpoint, and I said this previously, I went to do an intervention at somebody's house, and it was for alcoholism. And I walked into the house. The first thing I saw walking through the door was this person's open, meaning there was no doors on it, liquor cabinet and wine, like a wine fridge, but it was all clear. So I'm like, how do you expect this person to not want to come home every day from work when they're battling alcoholism and it's glaring them in the face? Or when your kid sees you coming home from a trip and talking about this bottle and 30 something years old and how great it is, and that becomes the focal point of your meal. Or talking about the wine. I mean, I was hosting a bunch of yeshiva guys for a dinner in Israel for Sukkot a few years ago. And one of them sees a bottle of wine that we took out for Kiddush, and he goes, "Oh, that vintage, that's a great one." And I looked at him and I said, like, you actually know what the heck you're talking about? Like, seriously, you're an expert here? Who are you? I like to say in our house, my alcohol is not on public display. I have no problem taking it out to make a l'chaim. It comes out to the table, fills up the glass, goes back into the cabinet. It is not the discussion of the meal. It is not the, oh, wow, this is great. It's about leading by example. As far as marijuana, yes, I do agree. But also, unfortunately, there's many people that we know that are, again, in their 40s, late 30s, that are, using, whether it's recreationally by smoking it, vaping, wax, edibles. And it's very hard to say to your kids, this concept that we had growing up of do as I say and not as I do, that doesn't apply in today's world anymore. It just doesn't. So when you have parents making comments about like, well, it's okay for me, but not for you, the kids are going to do it anyway. So the idea really is lead by example, lead by example. Don't think that it's just okay because you want to do it. If you do it, they will do it.
And a little bit different question, but similar. Now, let's say there are parents who themselves actually have usage problems with alcohol. How can any tips for them on educating their children about problems related to substance use? That would be.
Are they in recovery or they're actively using? It's a loaded question you're asking there, one that we deal with every single day. So if they're in recovery.
So this question came from one of the members, participants who's here today. If they would like to clarify, they can. Otherwise, you can address it from both angles.
So I can address first. If they're in recovery, then be open and honest with your kids about that. Because like I always say, when we do a Seder, we'll do a sober Seder one night, we'll do a regular Seder. That means at my sober Seder, there's no alcohol. You could tell me that your family's custom is you must have wine. Great, drink someplace else, go to another house. Because a sober Seder means it's a sober Seder. There's nothing wrong with educating kids, not just about the halachic aspect that you could have an excellent Purim meal with grape juice or a Passover Seder with grape juice, but also educating with the concept. And this is something that I speak about publicly all the time. If you offer somebody a l'chaim and they say no, never ask a second time. Because you don't know if this person's in recovery, battling their addiction for a week, a month, or 20 years. And you don't want to be the one who's going to cause this person to take that first shot again after so long and now, fall right back down that rabbit hole. So when a parent can say to a child, I'm in recovery, I overcame this issue, I'm going to meetings, there cannot be alcohol when I'm here, that's actually a tremendous leading by example. At the flip side, if the parent is still actively battling it, well, parents that think that their kids don't know what they're doing, I mean, I could safely say that's probably the biggest mistake that we see, especially when dealing with all sorts of addictions. Kids learn and pick up on things very quickly. They might be great at hiding it. They might, the same way we talk about domestic violence, where kids, they know what's going on. What, are you going to hide the fact that something's happening in the house? But at the same time, people believe that they're hiding it. So if somebody is actively battling something and they want to do better for their kids, here's my advice: get help.
I echo everything you just said. So that was so good. Yes, I agree. I agree.
So Esty, what can parents do to help prevent substance use? And then a part two of that question, are there aspects of family life or communication that can be helpful in prevention?
So I think that what parents can do to help their kids is really have open lines of communication. Tell your kids up front, no matter what you do, as long as you're honest with me, there's going to be a safe place. Like, build a safety within the relationship with your children, educate them, show them, help them, teach them, show them, educate them. Another thing parents can do is really make space for teenagers to be teenagers. Like, I think parents are always like, they'll say, oh yeah, how tough it is to be, to raise a teenager, but really to understand what a teenager is going through and to make space for those tumultuous emotions, for the ups and downs, and just make space for that. I think that can be really helpful, to be understanding to your teenager about what they're really going through. And what was the second part of your question? What to notice?
The second part are there aspects of family life or communication that can be helpful?
Okay, I think I covered the communication. Yeah, I mean, studies show that if, it's a huge resource for a child to have a loving family environment, be home when your kids get home from school, hang out with your kids, spend some time daily with them, all that kind of good stuff, yeah, that can help too.
I echo exactly what you say, and I'll just add one more piece to that. When you're sitting at the table, which I strongly suggest parents learn how to do again during the week, not just on Shabbos, don't bring your phones with you. Children very much learn quickly that you value your phone more than them, you value your business more than them, your job, your work, your friends, etc. If you're having dinner with them, or if you're playing a board game with them, which, by the way, I'm proud to say I probably do more often than anyone I know during the week. That's the way I get to spend quality time with my kids. Phones don't come next to us. Really show them that they care. And the reason for that is not just based on the discussions about addiction, but it also shows that you're there for them. And just like Esty said, communication is the key. If they feel comfortable with you, if they feel safe, they'll reach out to you when there's a problem. You don't want them reaching out to somebody else.
Thank you so much. We're going to shift into a few questions that focus on specific scenarios or specific substances, and participants eager to kind of know a little bit more about that. But if anyone also has more questions about identifying substance use issues or navigating the challenges within the family, please submit those, and we can bounce back to those sorts of questions as well. So getting to specifics, a lot of people are curious about marijuana, like you alluded to before. And people are saying it's natural, it's legal, and it's the only thing that really helps me to relax. So why are people saying it's a bad thing? Like, is it even addictive? That's a big question. And then people are also curious about like CBD, and is that dangerous? And could that lead to other substances?
Let people actually research. And I mean this in a bad way. I want to say this very straight out. But I get these questions all the time, and I'm sure Esty does as well. I'm not going to speak on the clinical aspect of it, but I will tell you practically, anybody that comes to me with the questions asking the difference about addictive or not, my answer is, why don't you first research it before you ask me? Not because I don't want to educate people, but I want people to learn how to look into things. And by the way, mushrooms are natural too. I think everybody should start using shrooms and start hallucinating and run in front of trains and jump off buildings. Just because something is natural doesn't mean it's good. Okay, natural just means that it comes from the ground. Poppy seeds are natural. Hey, opioids, heroin, let's go straight for the gold. It's all natural, but it's not. So at the end of the day, if you want to talk about marijuana, it's becoming legal. And I could say this probably for the same reasons why prohibition ended, which is there were too many people getting killed, too much of a financial gain, too much of a market. So therefore, it's a better for the society as a whole, according to those, to make it legal versus keep it illegal. But if you look at the Colorado Highway Safety agencies report on car accidents and death from car accidents, so it's starting to actually, the numbers are increasing ever since marijuana became legal. And the fatality rate has been doubling year over year. in the last 5 years, and it's actually catching up to alcohol. Now, alcohol, which is also legal, is still the #1 cause of death in motor vehicle accidents. Marijuana is coming up to it. 2, marijuana might be legal, but let's not forget something. Even if it's legal, it doesn't mean people can always get it. So they're going to get it from their dealers. Now, everybody will turn around and say, oh, but it's natural. It's natural. Well, guess what? 3 summers ago, we had close to 20-something overdoses in the Bronx that were caused by marijuana that was laced with fentanyl. Now, fentanyl is 100 times more potent than certain of the heroin family drugs given in, medical settings, okay? And something that is being used both on street drugs, but even on marijuana to make it more potent. So again, I'm sure everybody's friendly drug dealer is very ethical and honest about everything that's going into the drugs because they're not looking to sell more of it. So again, and it helps them relax. I don't know, so does yoga, meditation. Maybe they should start seeing a therapist, and you know what? I got to tell you, for those that need it, let them see a psychiatrist. You can get certain medications that are prescribed and managed. Again, just because it's legal and just because it's natural doesn't make it good. As far as the difference between the different chemical components and breakdowns, the reason why I don't answer it, and Esty, by all means you can, is because in my experience, when I go into high schools, the few that let us come in and actually talk to the kids, I'm talking to pharmacological experts over there. These kids have already learned every dosage, cutting, breakdown. It's like, okay, so you guys should all become pharmacists. You're great. You know more about this than anyone I know. So I always say, when I start answering those questions, I'm opening up the Pandora's box to try to find ways to make it acceptable. It's not acceptable. It's not good. It's not okay. It causes death. It causes brain function to be diminished. It causes car accidents, and it causes lack of healthy decision-making. For all those reasons, it's not good.
Thank you, Rabbi Gluck. Esty, is there anything you wanted to add to that question?
I think Rabbi Gluck did a really good job of covering it all. Yeah.
Perfect. And I can just say, just to speak to the clinical part of it a little bit, the marijuana plants today have a lot more of the psychoactive component than a long time ago. And so it's not necessarily even the same thing that somebody's parents tried once upon a time. The ingredient that makes people high is present in a greater percentage than before. And things like, poor memory, poor concentration, increased aggression, car accidents, like Rabbi Gluck said, worsening of underlying mental health conditions, including mood changes and suicidal thinking, and worsening of anxiety in some cases, are all risk factors with teen marijuana use. And also in a vulnerable teenager, this will increase the risk of psychosis, which is feeling paranoid, having hallucinations, having delusional thoughts. So, and this is more likely in the teenage brain that's still developing. And when used chronically, it can decrease motivation and interest and really interfere with academics and jobs down the line, and actually create mental health problems more than alleviate them. So I did get another great question asking, how do we talk to children about an addiction of an older family member? So bouncing back to that sort of question, Esty, how do we talk to children about an addiction of an older family member?
I think it's important to be really honest. Addiction is a family disease. So if an older family member has an addiction, an active addiction, everyone in the family is being impacted and affected tremendously. And so it'll be really important to be honest and speak to the younger children, give them a safe space to discuss what it's like for them as they notice their older sibling, coming in and out of whatever it is, rehabs, and really just having family conversations, like seeing what, the children will need more support, the parents will need more support, everyone should go to therapy. And there are also Al-Anon groups, which are for the family members of addicts. So that would be helpful for the siblings as well.
Just remind with one statement that we've been using a lot lately. The opposite of addiction is not sobriety, it's connection, and it's human connection. So we also have to remember one thing. Addiction is a disease, like Esty just said. And the same way we don't blame somebody who has a heart attack or has heart disease, coronary artery, has lung issues, asthma, high blood pressure, we need to really drill it into ourselves when it comes to addiction as well. The stigma associated with addiction is still the number one reason people are refusing to get help. And it's also the reason why so many people that are young are dying of aneurysms and COVID, because there's always another reason for their death. It's never the addiction. And that really needs to be stopped. I mean, just as recently as today, I got a call from someone about doing an intervention. And when I started setting up a treatment plan, the first thing they said was, well, we're part of a community. There's a wife, there's kids, whatever we do, we have to keep that in mind, which I fully respect. Don't get me wrong. But I also understand that that's the reason why we can't always do what we want to do. So when it's dealing with the family, it's really understanding it is a family disease. And the quicker we can stop being ashamed of it, the quicker more people will reach out for help.
Thank you so much for reiterating that point, because that is the foundation of everything we're talking about and the purpose of why we're having these webinars. We really want to create awareness so that we get rid of the stigma so that we can prevent and respond to these issues. We might get back to some more particular questions about substances, because it does seem like there was a lot of curiosity on that. But let's talk a little bit about treatment. Someone asked, how is adolescent substance use treated? Are there certain things maybe unique to treating adolescents, or just kind of the general framework that is used? Esty, would you like to start?
Yeah, I would say that it's the same general framework. So there's individual therapy that uses CBT, cognitive behavioral therapy, motivational interviewing, group work, 12-step recovery. Those are some of the main things that will be helpful in treatment for addiction.
The difference with adolescence is if you're lucky enough, you catch it quicker. So if you catch it quicker, you can actually, like early detection, early prevention, early, healthier living. However, the same answer that we would give, it's the exact same. If somebody breaks their arm and they're 60 years old, or somebody breaks their arm and they're 20 years old, there is a slight difference. They're both going to need to get the same treatment, but the person who's older will need to have, a more serious type of physical therapy, for example, because of the fact that their body may not be able to withstand it as much. It's the exact opposite when you're dealing with people that are younger. So, and the other thing is, 15 years ago, 20, 22 years ago, when I first started in this, I don't think I ever dreamt that I would see a 14-year-old heroin addict. I'm going to be honest. I never thought it was even possible. I mean, the kid that was using X was already like, if they were 16, it was like, it's a club drug. You're under 18. What are you doing? What we're seeing today in the world of addiction is something that there's no words to describe it. However, when it comes to the treatment component, especially with adolescents, we can even go as simple as detox, for chemical dependency, where you need to get, a true medical detox component to get them out of it. How many parents do we have that say, no, my kid cannot go to detox because then their yeshiva or their school or whatever is going to throw them out? Or other variables. I have other kids in shidduchim, people are going to know about it, or all these other components. So it ends up that, you throw the baby out the bathwater, the kid is not going to get the help that this kid needs. The family won't be supportive of it. And even when the child has a teacher or an educator in the school who reaches out and says, listen, this kid needs help regardless, but now the parents are fighting it. So instead of being a part of the recovery process, it now becomes the flip side. That becomes a very, very dangerous task. So the treatment component, the actual core treatment, is the same, but getting them to agree for the treatment is much more complex. And by the way, it works on a few sides, because it's like the same thing I would say, how many times do I try to create protocols within schools? And I'm like, listen, if you have A, B, and C protocols, more people will reach out for help and feel comfortable knowing they're not going to get into trouble for seeking help. But then all too often the schools come back and say, well, if we do that, then people are going to think that we're a school for people with drugs. And I'm like, no, if every school did it, they wouldn't. So it's the treatment's the same, but unfortunately, the getting them to the treatment, the younger people are, the more difficult it is for reasons, which is why I'm always happy to participate in things like this, because if we even change one person's mind, get one person to see things differently, it was worth all the time in the world.
Thank you. And another question we had, Esty, was, in your experience, and you can both answer this, but do girls and boys have different needs when it comes to treatments, or, extending on that, are there different vulnerabilities that you've noticed that might lead, a girl or a boy to develop a substance use disorder that might be more unique or gendered in some way?
Interesting. Rabbi Gluck, I'll let you take that first, since I don't really.
Yes, I'm actually running a live report as I'm talking to you in Power BI, only because I like to give data answers as accurate as I could. But I will tell you, the last time I ran these reports, it came back that it's just about 50-50. Okay, I would say 60-40, 65. But the point is, though, it's not anymore what it was. And it doesn't mean that it was different. It just means that for whatever reason, we may have not known about it. It may have been hidden better. It may have been masqueraded better, whatever other things it was. Because I don't believe that this was ever something that there was an issue more in one or the other. But again, let me say something very point blank. And I know it's being recorded and I'll deal with it later. The difference between, in our community, a boy and a girl getting into trouble and doing things like this is very simple. A boy does this trouble, does what he wants, magically goes to Israel, comes back, and magic, wow, this kid is great, everything is amazing, he can get the best shidduch in the world. Versus a girl, they carry the reputation for a very, very long time. So therefore, it is something that we clearly see that makes zero, that's a big problem. However, by the way, it's about a 60-40 split. I'm just looking at the numbers right now in our database of, substance use disorders. So it's about 60-40. And I just ran a report from 16 through 22. I didn't even bother going into the older ages because there I know it's already 50-50, meaning married couples doing things together, and which makes it even more complicated because if one wants to go for treatment, the other one says, I can't go now because my kids need me. So then what happens is the first one comes back, and in the 2 days that they're together, they're both back to using again together, and it becomes a vicious cycle. But if I tell my parents or my in-laws, they're going to force me to get divorced, so all these things play a role in it. But because of the fact that in our community, it's so easy for a boy to get himself back, on track, and girls not. Girls did a much better job at hiding things in a, in a different way. But what we're seeing now is that a lot of that, it's funny, the stigma is still there for getting people help, but it's not there when it comes to those who are, the teenagers who are saying, I don't care what my parents think, I'm going to do what I want to do anyway. So I'm not sure when they're going to wake up and realize that it's coming on both sides, but we are seeing it very, very equal on. And by the way, this is on all substances. It doesn't matter whether it's alcohol. I mean, I could say the same thing. I mean, let's also not forget, we're talking about addictions, right? Process addictions, gambling addiction, sex addiction, porn addiction, internet addiction. Addictive behaviors and addictive components are destroying lives and families every single day. And even on those components, we're seeing them also equally. I mean, sex addiction, we're seeing also the same by male and female clients. So the answer that we're seeing, again, but don't forget, we're on a communal side. We're not running a clinic. So it's a very different angle of what we're seeing. But that's what we're seeing. I would love to get some sort of report from therapists, because just because people are coming to us doesn't mean they're following through and then going for therapy, because that's still that step that is still very stigmatized. And to help people get away from the stigma, not that it means anything, who am I, but I'm proud to say I'm in therapy once a week. Not embarrassed to say it. I see a psychiatrist once a month. Not embarrassed to say it. Everybody should.
Yeah, I really appreciate that. I think that the stigma is lifting a little bit. I think that I've heard from some teenage clients that they're very open with their friends, and that everyone's seeing therapists, or many of them are. So And yeah, I just appreciate your honesty and vulnerability, Rabbi Gluck. And I think it's important that we all like lose the stigma. It's courageous to go to therapy. It's courageous to get help. And so, yeah.
And therapists are my friends. They got to make a living. But I do see that somebody just posted again, I can't read up, Dr. Weinberger posted again regarding the CBD. I'll just answer that very quickly. I didn't want to get into it because yes, they're always busy talking about how, it's really not a big deal, but let's understand this, okay? I'm going to pronounce this wrong because I always do. Cannabidiol, if I pronounced it right, which is the CBD, is the essential component that was primarily being used for medical marijuana. The CBD in and of itself was not designed when it was initially used to create a high. So that is why very many times people will say, well, CBD does A, B, and C for me, but it doesn't cause problems. The problem is that the CBD that's being made today, which is the synthetic version of a synthetic version, which is being lab manufactured, is actually starting to create the components of getting people high. But there's also other components, which is, while it certainly does have benefits of helping, whether it's anxiety, whether it's insomnia, chronic pain, or things of that nature, everybody seems to forget the other side of CBD is it creates blood thinning. Okay, so people that are prone to heart attack, have a genetic predisposition for coronary artery disease, a lot of medications for that are not going to work. They slow down liver metabolism. Okay, people don't talk about this. So that's another big concern. Also remember, even when CBD is being used, it's being used as a supplement. It's not supposed to be the answer, even when it is. And listen, I could say this. My mother has an illness that we were trying to get her to use medical marijuana based on it, with the understanding of it, because for her situation, it would have been helpful. Okay, she still refused. My point is, I'm not against something if it has a medical component, but that's not the treatment. That's a treatment. It's almost like saying somebody's going to see a therapist and they only want EMDR. I don't want any talk therapy. I just want EMDR. I mean, like seriously, no, that's a tool to be used. The other thing also is that CBD has a tremendous cause. Even though it certainly helps in the reduction of anxiety, it actually creates anxiety too. And it actually creates paranoia in many areas. And so there's a lot of components of it that are really very dangerous. So yes, if somebody says it's a medical reason and my doctor wants me to take it in conjunction with other things and it's being monitored, listen, it's the same thing as saying my doctor wants me to take a certain medication, okay? But at the same time, it is something that needs to be understood. And somebody asked me a question, I'm going to come out straight and say it. Do I consider smoking tobacco an addiction? Yes, I do. Okay, so why do so many people still smoke? Because they're crazy. Yes, myself included. Embarrassed to say it, but it's true. It doesn't mean it's right. It doesn't mean it's healthy. It doesn't mean it's good. And it doesn't mean that I'm not trying to stop it. It also means that I understand that there are things that become addictive and it's very hard to get out of. So why would I not want to promote people not to make those same mistakes when I'm living with something for many years?
Thank you, Rabbi Gluck. Yeah, on the topic of CBD that we were talking about, since we're here with parents and teenagers, just for everyone's knowledge, as far as I know, CBD is FDA approved for kids only in specific forms of epilepsy, and there's not really enough evidence to recommend it for other uses. So if you want to know like where the evidence is and what the recommendations are in children and teenagers, it's only really limited to a very specific use, and there's limited research. So there's a lot that we don't know about when it comes to that. Also on the topic of tobacco, and Esty, if you want to answer this, feel free to jump in, or Rabbi Gluck. We did have a question about vaping. So like the teen said, I know cigarettes are bad, but what's wrong with just vaping nicotine?
Yeah, I'll just jump in and say that I know that there's all this like there's this idea out there that vaping is so much less harmful than cigarettes. And while it's true that vaping does deliver the nicotine in a slightly less harmful way, it still is not safe. And the new research studies are showing that vaping still has very harmful effects on the lungs and elsewhere. So it's not a good idea to do.
I'm going to add to that also. Yes, technically speaking, when somebody says to me, but isn't it safer than a cigarette? So first of all, if you smoke and you want to use it as a tool to quit smoking, that is one discussion. But when I'm dealing with a teenager who's not smoking at all, so what? You want to use something that you shouldn't be using or because it's quote unquote healthier than a cigarette. But also remember something else. Vaping, while maybe not healthier, not as healthy, less of this chemical, more of that chemical, the amount that people vape are 10 times the amount of a cigarette because they do it in their car, in their house, in the school, in a bathroom, because there's no quote unquote secondhand vaping. So by definition, even though it might be less nicotine than a cigarette, it's actually 10 times more by the time you're practically doing the mathematical equation. And the other thing is, what's coming out now is a lot of these flavors that people were using in vaping. Now, there's two different issues. One of them was that like the FDA made it illegal because it was targeting kids similar to like, Joe Camel, if that was his name, I don't even remember, the Camel guy or the Marlboro Man were deemed to be illegal because, and as were the Marlboro Miles and all those other, things, Camel Cash. I'm trying to remember stuff when I was in high school. I mean, most of this doesn't exist anymore, is because it gave people too much of an incentive to want to do it. So at the same time, when it came to vaping, that was the number one reason that they got rid of a lot of the flavored vapes, was because it was targeting teenagers. However, now they're coming out with the studies, which again, it's not as, how do I say this? It's not around long enough to have real true scientific studies with a 1-year data point, 3-year, 5-year, 10-year, et cetera. But what they're starting to realize now is that, yes, in cigarettes, I think there's about 7,000 toxins in cigarettes, and it's like, I don't know, 5,500 in vaping. But of the toxins in the vapes, when there's flavors associated, those actual flavors in and of themselves are actually much more harmful in the long run, not so much from an addictive component, but a lot of those things are not lab tested the way they're supposed to be because just putting in a little bit of a flavor, and the flavor is good for something else, not realizing the combination when used together with this. So yes, I always tell teenagers, technically speaking, if you're doing, apples to apples, yes, the equal amount that somebody will vape versus that somebody will smoke, vaping might be considered a safer alternative. But that's only safer if you're using it to quit smoking. It's only safer if you're using it to stop other harmful habits. But if you're vaping 10 times more than you would be smoking and you didn't smoke in the first place, please don't sell me that it's safer, because on that, it doesn't make sense.
Thank you. Before we head towards our wrap up and concluding remarks, I wanted to just ask a couple more questions submitted by some teenagers. And also if anything else comes up in the chat, I'll still monitor that. So one question from a teenager, SD, is I went to a party or a camp or a dorm and I used something. Now what? How do I tell my parents? Is there a point if they're going to kill me anyways? How would you, address this? And like, this is clearly a teenager who did something. They feel like they should tell somebody, but they're scared that they're going to get in trouble, and they probably don't know where to turn.
Yeah, first of all, I want to give credit to that teenager who sent in that question. That's awesome. The way that we get help is by courageously reaching out and asking. I would like parents to have an agreement with their kids that they don't get into trouble if they're honest. I think that's really important. I would tell the teenager to sit down with their parents and say, I have something to share with you and I feel scared to share it because I feel like you're going to kill me. And can I have your word that you will not kill me? And kind of like set up a deal ahead of time and definitely tell their parents and get the help that they need. And I would also normalize it for them and let them know, look, it's normal. You're at a party and there was probably some peer pressure. Really understand what teenagers are going through, but then offer them, other alternatives. Like Robert Gluck said earlier, there are other ways to learn to regulate your nervous system. If someone's anxious, there are really good other ways: the meditating, the yoga, the journaling, speaking to a friend. There's so many other ways that can really help someone to set themselves up for a successful life. And I think that that's really at the core of this issue, is that when teenagers use things, they become isolated and numb, and they don't develop the emotional bandwidth that they really need in order to have a successful life. We want to really help them to do that so that they can be successful in their lives.
I'm going to reiterate that, again, if the parents make it comfortable for their kids to talk to them about this, this is an amazing question. God bless whoever sent it in. And Esty, you're right about saying that it is courageous is the right word. But I would say it'd be more courageous if those parents would have spoken to their kid and explained it, that, you can always come to me. And I mean, I say the story, and I'm not condoning or not condoning. I'm just going to say the story just to bring out a point, which is, I know somebody that made a deal with their kids. I don't care what you do. If you're in trouble, you can always call. And if you call for something yourself, you are not going to, when the case is closed, we're just going to get what you need. And their teenage child got really drunk, trash drunk, wasted at somebody's house, called his father and said, Dad, you said I can call if I ever need to. Here's the situation. This is where I'm at. His father came, picked him up, drove him home, never said another word about it the last time the kid drank. It accomplished both. The kid felt safe, and he also, by the parent not having to say anything, they were able to actually deal with it. I will mention there is a question that just came in. I just think it's important to mention this, where somebody's about to have a major surgery and they're told that they're going to have to be on major medications. What do we do? So the answer is as follows. If the person is in recovery, then I'm sorry, but you tell the doctor, find me an alternative or something else, or you have to deal with the pain somehow, because for that, there's no excuse to fall back. However, let's be very realistic. Not every person that gets prescribed medication is going to become addicted to it. And yes, while we do realize that it's sorry, Dr. Eichenbaum, but we do realize that it's the medical profession that was so easily to prescribe pills and not manage them. They're getting a lot smarter now, due to some very interesting lawsuits. 85-year-old grandma has a hip replacement surgery and gets put onto a fentanyl patch, which true. Now they're starting to use buprenorphine patches. They are shifting away from the fentanyl. We understand that. But the point is they were getting transdermal, patches that were helping with things, and they were not necessarily getting addicted to it. So the real trick is that if someone does not have an addiction and they do need a certain medication, as long as it's monitored appropriately and the medical professional is only giving enough for, the first 3 days after surgery, X amount, and then coming down and actually testing and monitoring it. Again, if things are done in a safe and a healthier environment, obviously, if somebody can avoid getting any prescription painkillers, that's always the best, because, the only thing painkillers does, I'm sorry, yes, it mimics the nervous system to let you feel that you're not having pain. There's no actual medical benefit to the patient other than being able to not be in pain, which is very important. Don't get me wrong. But then again, when we do look at chronic pain management and people that have become addicted after a car accident, or, the amount of cancer survivors that we're dealing with that have serious, substance, misuse components right now as a result of it. So the answer to that is yes, it is tough. If you can avoid it, avoid it. If you're in recovery, then you tell your doctor, I'm sorry, this is not for me. I battled this once, help me figure out another solution. And if not, and if there's no history of addiction, and they do, and it could be monitored safely for a short amount of time, then as long as it's managed efficiently, effectively, and practically, then people can do what their medical professionals are suggesting that they do.
Thank you. We're going to ask, I'm going to ask one more question, and then we're going to wrap up. So the final question, also from a teenager, and Esty, I guess you can start with this one too. So my friend has ADHD and takes pills to do better in school. He gave me some to try, and now I can focus better too. Is there a difference between us? And maybe in answering this question, we can also touch on, how ADHD treatment, for some people is good for preventing substance use in the future.
Yeah.
But how taking pills from someone when they're not prescribed for you can be very, very problematic.
Yeah, I think Rabbi Clark mentioned this earlier. The big difference there is one teenage kid has been diagnosed with ADHD, has gone to a doctor and is on prescribed medication, and that's fine, that's good. And like you said, that can prevent substance abuse in the future. Like this kid is managing his diagnosis, but the other child is just taking someone's pills, and that's not okay. So I guess that's just the major difference. It's okay. It's great to, if someone needs it, it's great to go to a psychiatrist and get what you need and take it as prescribed. The problem starts when you're just taking other people's pills and just using them, without being prescribed it. So I think it's really important for kids who are struggling and do have concentration issues and may have ADHD to go and get checked out and get the support that they need. And sometimes that's medicine, and that's fine. That's important. It's important. Yeah.
I second that motion fully.
Thank you. So it's 9:20 right now, so I guess it's a good time to start wrapping up. So I want to thank everyone here, the panelists, Esty and Rabbi Gluck, for coming here tonight to really educate us and increase awareness. So thank
Sorry
you.
to cut you off, but I'm not really sorry to cut you off. I'll cut you off anyway. Actually, thank you. And thank you, Esty, as a professional for doing this, because from our perspective, all of us in the organizational side of things, we could scream till we're blue in the face. And we try to. And there's always the same excuses coming back. Oh, you're only speaking about it because you're going to raise money off it, or you're going to this. I can give you every excuse in the book, and that's great. People that want to hate will always hate. But having the medical community, an association of medical professionals, as well as the mental health professionals, the clinicians, really start showing a much more proactive and preventative approach is something that makes all of our jobs much easier. So I really want to say a thank you to both of you and to the various professional associations. I mean, obviously I have to be selfish here. My wife, who's also a, medical professional, she's a nurse, not a doctor, but she's still very involved in these things. So I fully respect it. But at the same time, it's really a thanks to you guys, because it's one thing when people are doing it professionally, but it's another thing when they're able to step up and talk about it. And I don't know why you'd go into psychiatry, but God bless you for doing it. And Esty, really thank you for your insight, from the clinical side. So it really makes our jobs a lot easier. So thank you.
Well, I'd like to thank you, Rabbi Gluck, for your passion about helping others. It's really commendable. And I just thank everyone that was involved in running this. Thank you, Dr. Eichenbaum and JOWMA and everyone else. I feel grateful that I was able to be a part of this tonight. And thank you to every single participant that showed up and is listening and is asking the questions, the parents, the teenagers. Thanks to all of you guys. We're going to just all partner in this together to make a difference. So thank you.
Yes, and hopefully, this will be the start to more discussions and more conversations. And I appreciate so much everything that's been said and all the questions that have been asked. So we are going to put that QR code back up on the screen in a moment. And like we mentioned earlier, if you scan this and complete the post survey, you'll be eligible to win a $100 Amazon gift card. Filling this out will give us more useful information to inform future webinars and discussions. We appreciate all of the feedback that you can give us. Also, everyone who participated here today will receive a follow-up email with a link to a YouTube recording of this webinar. We'd like to encourage you to subscribe to the JOWMA YouTube channel, where you can find more of our health education content. Also, this was part 2 of our JOWMA Substance Use series, Part 1 took place last Sunday evening and is now available to view on YouTube. So I encourage everyone here tonight, if you didn't get a chance to watch that one, it was also really, really great. And hopefully you guys can tune into that too on our YouTube channel. The link for the survey is also here in the group chat. Yep, I guess at this point, everyone's had a chance to scan and go to the post survey. Everyone can leave now. You're all dismissed. And thank you again for joining us. Bye.
Take care. Bye-bye. Have a good night. Bye.